the targeted arena has been the one that's really exploded in terms of stage 4 disease or advanced disease. So up until a couple of years ago, we were in the realms of just EGFR, ALK, and ROS1, which made up still a reasonable proportion of those patients with driver mutations. But since then, we've seen an explosion of other markers that not only are we testing for, but also some for which we've got reimbursed treatment options, but for one where we're seeing clinical trials showing great or quite exciting activity. I think ones that have already come into play, one would be NTRK, exceptionally rare, but for which there is there are very potent and effective targeted treatment options. Leading on from them, we're into the realms of looking at BRAF. Adding on to BRAF, we've got MET exon 14, RET. Another area of excitement is HER2, and also going back to EGFR, but EGFR exon 20 insertion mutations, which have been very hard to target. An area another approved drug is looking in the KRAS field. So KRAS makes up quite a reasonable proportion of patients with driver mutations. There's been one that was often termed or deemed the undruggable mutation because we've really found difficulty getting traction there. But now we've seen very exciting data looking at specifically the KRAS G12C mutation. And we're already in the realms of having a drug approved in that setting with a whole array of other KRAS inhibitors on the scene. I think probably the other aspect that we're seeing is that the targeted therapies are moving into other stages of lung cancer. We recently had approval of Osimertinib in the adjuvant setting following the ADAURA data. And there are other trials ongoing looking at other targets in the adjuvant setting, but also in the neoadjuvant setting. So again, the realms of targeted therapies is not just only expanding in the advanced field, but also in early stage disease.